Hi, my name is April Cook, Term 2, Section 2, Adult Health 1, IV insertion. I have initially checked my physician order. The physician has ordered for an IV to be placed for antibiotic therapy on my patient. I've checked their allergies. There's no medication allergies or to food or medicine, so my patient is able to have the medication that has been ordered. This is the right patient, verifying the wristband. I've checked the route. This is the correct route, IV. And all my labs have been verified, and I'm going to place a 20 gauge IV, and the vein, the 20 gauge is able to hold the IV antibiotics and any further future fluids that may be ordered for my patient. First, I'm going to prime my tubing. I'm going to clean off my vial with my saline, and I am going to pull up 3 mLs. Alright, inject. And I'm going to pull up 3 mLs. Alright, that's 3. I'm going to recap this. I have a sterile extension tubing that I'm going to prime with fluid. What I'm going to do is go ahead and open that, keeping it inside the bag so that it doesn't touch the counter. If it does, I would just need to sanitize it with alcohol. Go ahead and unclamp my tubing. Go ahead and prime my tubing. It's primed. Keep my syringe attached. It's primed and ready to go, and I'm going to clamp it back. Alright, next is the reasons that I am choosing the spot where I'm going to insert my catheter. This is a non-dominant hand for my patient. It's non-dominant. He doesn't have any obvious deformities or pain or sores, anything along that line. The vein is visual to the eye that it would be able to hold a 20 gauge needle without any problems, and it's accessible. Also, this IV is not going to interfere with any ADLs and activities of daily living for my patient. Okay, so I have chosen where I'm going to select my vein. Now I am going to apply my tourniquet 4 to 6 inches above the site where I'm going to insert my catheter, my INT. Alright, I'm going to go ahead and pull my catheter tight, doing a tiny little knot at any point that I can pull it off if I need to. Alright, after I applied my tourniquet, I'm going to go ahead and check. I have radial pulses on my patient, so the blood is not all being occluded, so that's positive. I'm going to wash my hands, apply my gloves. My gloves are being applied. Now, I'm going to take and clean the site of where I'm going to inject or start my IV in a circular motion. I've gone and I've circular motion. Alright. If I touch this, I would need to clean it again. Next, I'm going to insert my catheter. And I'm going to do this at a 15-degree angle, initially insertion, but first I'm going to secure my vein. Insertion will be bevel up. Alright, I secure my vein. I'm going to insert at 15 degrees. Insert. I'm going to drop it down, advance it some more. Alright, and advance my stylet. I've advanced my stylet. I have a flashback. I noticed a flashback. Positive for flashback. I'm going to apply pressure, take my needle out, sharps container. I'm going to pop my tourniquet. Now I'm going to verify placement. And by verifying placement, I'm going to go ahead and attach my extension tubing. And go ahead and pull this off. Alright. I'm going to go ahead and do that. My catheter is in. Alright. Pull back a little. I have blood. Pulling back a little. Now I'm going to non-resistant go ahead and flush my extension tubing and go ahead and flush. It flushes beautifully. I'll do the stop-go method so no clots form around the end of the catheter, and while I'm flushing continuously, I want to clamp my tubing. Now I'm going to go ahead and I'm going to disconnect my tubing. I'm going to take and put this transparent tape over my insertion site. I take it, put it over my insertion site. This is going to have my initials, date and time, and the gauge, and make sure that I can see that. After that, I'm going to go ahead and tape my tubing so that it doesn't get caught on anything, and keep it in placement. It's clamped, it flushes well, the patient tolerated it good, there's no infiltration, it didn't blow, there's no bruising, there's no pooled saline around the injection site. Now when I document, I'm going to dispose of all my needles. Now for my document, I'm going to do my name, date and time, the insertion site, which arm that I used. This would be considered this person's right forearm, and the size of the catheter. I use a 20 gauge catheter, and I got it on one attempt, and the client responded well. Has complained for no tenderness to the injection site other than the initial stick, and I instructed the client to don't mess with it, leave it alone, don't pull on it, and then I'm going to go back and hook up my antibiotics, and that is how you inject an IV.